When people first start assessing patients, they tend to want to rush straight through the subjective assessment and get straight to the objective assessment, because in the objective examination you can put your hands onto the patient, you can do those anatomical tests that you've learned, you can put structures under strain, and that in theory will give you the diagnosis that is what's giving the patient their symptoms. But that's the wrong way to go about it. You shouldn't underestimate how important the subjective examination is. The subjective will give you so much information. It'll give you information about the actual structures that are at fault that you're going to need to go test. It'll give you indications of the patient's severity, the irritability, and from that you can plan a really structured objective examination. Because if someone's highly severe and highly irritable, you're not going to go be able to perform lots of manual therapy techniques, because that might make the patient's symptoms worse. The subjective is there to give you what you think is your hypothesis, your primary, secondary, even a third hypothesis for what structure is at fault. Your objective is there to go and test those hypotheses, and from that you can either confirm them or you can get rid of those hypotheses. So the subjective will give you so much more information. It allows the patient to talk freely to you, so you'll get an indication as well of how it's affecting them, whether it's psychologically, emotionally, financially. There could be lots of different factors that you're going to have to take into consideration, as opposed to just trying to go and do some tests to find out which structures makes the patient's symptoms come on. It's a much more important fact-finding mission with the subjective than just finding a symptom that the patients complain of. So practice your subjective, be willing to spend time with the patients going through it, and then if you need to, you step out of the room just for a couple of minutes, you plan your objective. What must you test? What should you test? What could you test? And those must, should and could lists are going to be really important at making sure that you're very effective in your objective examination, and that'll give you a much better chance of getting an accurate diagnosis and also addressing all the factors that need to be addressed to get this patient better. So don't rush straight to your objective. Your subjective is so important. That's where all the answers are held. The objective is just going to confirm your thoughts that you get from your subjective.